So we're going to go ahead and start the session. This week, we're going to be talking about autoimmune disorders part 2, and we'll carry on from where we left off last week and address a few other autoimmune type disorders. And maybe you have some questions that you want to bring up for both Scott and myself to address for you as best as we can. If we don't know what's going on, we try to look it up or search the answers for you. But before we start the class, perhaps someone has something that they care to share, or if they happen to be new to the class, maybe you could unmute yourself and tell us how you found out about the classes. We're always curious about that.
This meeting is being recorded.
So, anyone have any thoughts or suggestions they care to share, or something they wish to talk about? I guess these classes are into the maturity stage where a lot of the questions have been answered, preliminary questions, and people are looking for additional information about specific topics. Not sure exactly what they might be looking for. So that's okay too. So we have a little.
I have a question.
Yeah, go ahead, Joan.
I would like Scott to tell us a little bit about the free cooking class.
I'm sure he wouldn't mind.
Yeah, I don't have a lot of information more than what's just on the website with the, if you click on the link from the newsletter, it explains the whole program. It's through the Adventist Church. So one of our Eugene plant-based providers, she's a dietitian, Crystal Williams. I believe she's a member at the church there, and they've been planning this for quite some time mostly for the church community, but then they wanted to spread it throughout the rest of the community more universally. And so starting in September, there's 4 Sundays in a row where they'll do a little cooking demonstration, show you how to cook 4 different things, and then you'll get to eat the food. And then while you're eating the food, everybody they'll do a little 20-minute talk. So it's all free, and yeah, it has like the schedule. I think if you go to the sign up form, it has a little more detail about what they're cooking and kind of the details about it. So yeah.
Thanks.
You're welcome. Yeah, I encourage everyone to sign up who wants to. I think they still have some spots open. I think they had 50 people is what they were, 50 people plus guests, I think is what they're limiting it to. But it sounds like it'll be lots of fun.
Thanks.
We definitely are going to be talking about thyroid issues tonight. So not to worry about that. And is there anybody else who might be new to the group? If you are, maybe you can unmute yourself and say hello.
And so we'll put in the chat that Seaspiracy is on Netflix.
Well, we're getting close to the 20 quorum number. Why I picked 20, I don't know. It just seems like a nice round number. And it's close enough, I think. And so, yeah, John, you don't have a mic or webcam, but you can kind of hear what's going on, so that's good. Hello to you. I know you've been here, and I believe since Oak Ridge time, so Glad to have you. So what we're going to do is I'm going to share my screen. We're going to play the first video, and then we're going to go bit by bit. Maybe you'll think of some questions between now and then, and we'll keep going. So I'm going to share the screen, and let's see what we can figure out here as a kind of a first step. We left off by talking about, I don't know, potassium and sodium and multiple sclerosis and ulcerative colitis. And now we're going to go on to benefit of flax seeds for inflammation. And then we're going to see which spices fight inflammation, because we're talking about autoimmune disorders, which tend to be maybe an overactive immune system, but these spices and other foods potentially can be helpful. So I hear a little noise in the background. I'm gonna maybe mute that. Let me see if I can do that real quickly. If I can go down and figure out who might need to have that muted. Okay. And then we're gonna go back again and share the screen. Share away, and let's go for some flax. Gregor has to say.
Previously, I've explored the potent antihypertensive effect of dietary flaxseed in hypertensive patients. This was a double-blind, randomized, placebo-controlled trial where they disguised ground flaxseed in baked goods versus flax-free placebo muffins, and got an extraordinary drop in high blood pressures. As you can imagine, the flaxseed industry was overjoyed, praising the impressive findings, as was I. After all, high blood pressure is the single largest risk factor for death on the planet Earth. Yes, we give people medications, lots and lots of medications, but most people don't take them, as in 9 out of 10 people take less than 80% of the prescribed blood pressure pills, just 8%. It's not difficult to understand why. Patients are asked to follow an inconvenient, potentially costly regimen, which will likely have detrimental effect on their health-related quality of life, to treat a mostly asymptomatic condition, so they may feel worse instead of better due to the side effects. The answer, then, is to give them more drugs to counteract the effects of the first drugs, like giving men Viagra to counter the erectile dysfunction caused by their blood pressure pills. How about using a dietary strategy instead, especially if it can just be as effective? And indeed, the drop in blood pressures they got in the flaxseed study was greater than the average decrease observed with the standard dose of antihypertensive drugs. And flax seeds are cheaper, too, compared to even single medications, and most patients are on multiple drugs, and has good side effects beyond their antihypertensive actions, but not all good. Taking tablespoons of flaxseed a day is a lot of fiber for people who've been living off of cheeseburgers and milkshakes their whole lives, and it can take a little while for your gut bacteria to adjust to the new bounty. So people who start out with low-fiber diets may want to take it slow at first. Not all studies have shown significant blood pressure-lowering effects. There have been over a dozen trials by now, involving more than 1,000 subjects, and though yes, put them all together, and overall there were significant reductions in both systolic and diastolic blood pressures, the upper and lower numbers, following supplementation with various flaxseed products. None were as dramatic as that 6-month trial. The longer trials tended to show better results, and some of the trials just used flaxseed oil or some kind of flaxseed extract. And the thought is that the whole is greater than the sum of its parts. Each of the components of interest within flaxseed, the omega-3s, the cancer-fighting lignans, all the soluble fiber and plant proteins, all contribute toward the blood pressure reduction. Okay, but how? Why? Right? What's the mechanism? Some common blood pressure medications like Norvasc or Procardia work by reducing the ability of the heart to contract, or slowing the heart down. And so it's possible that's how flax seeds work too, but no. Dietary flaxseed reduces blood pressure without cardiac involvement, but rather through changes in plasma oxylipins. what are oxylipins? Oxylipins are a group of fatty acid metabolites involved in inflammation, and as a result have been implicated in many pro-inflammatory conditions, including cardiovascular disease and aging. The best characterized oxylipins in relation to cardiovascular disease are derived from the long-chain omega-6 fatty acids known as arachidonic acid, found preformed in animal products, particularly chicken and eggs, and can be made inside the body from junky omega-6 rich oils such as cottonseed oil. But elevated levels of pro-inflammatory oxylipins in older subjects are normalized by flaxseed consumption. See, that's how he thinks flaxseed consumption reduces blood pressure in patients with hypertension, by inhibiting the enzyme that makes these pro-inflammatory oxylipins. I'll spare you from the acronym overload, but basically, eating flax seeds inhibits the activity of the enzyme that makes these pro-inflammatory oxylipins, called leukotoxin diols, which in turn may lower blood pressure. Identifying the molecular mechanisms adds confidence to the antihypertensive actions of dietary flaxseed, but that's not all oxylipins do. Oxylipins may play a role in the aging process, but we may be able to beneficially disrupt these biological changes associated with inflammation and aging with nutritional intervention like flaxseed. Older adults around age 50 have higher levels of these arachidonic acid-derived oxylipins compared to younger adults around age 20. These elevated concentrations of pro-inflammatory oxylipins in the older age group may help explain the higher levels of inflammation in older versus younger individuals. I mean, as we get older, right, we're more likely to be stricken with inflammatory conditions like arthritis. So this elevation of pro-inflammatory oxylipins may predispose individuals to chronic disease conditions. But what if you took these older adults and gave them muffins, ground flaxseed-containing muffins? 4 weeks later, their levels dropped to here, right? Down to like 20-year-old levels, demonstrating that a potential therapeutic strategy to correct the deleterious pro-inflammatory oxylipin profile is via dietary supplementation with flax.
I'm going to stop there for a moment and kind of discuss this with you. Dr. Greger recommends a tablespoon of ground flaxseed every day. I've listened to various videos about maybe 2 or 3 tablespoons of flaxseed may be okay, particularly if you have hypertension, or maybe if you had some autoimmune disorder, having a bit more might be helpful for having less pro-inflammatory changes. The science is pretty fascinating. You don't have to remember all the words. I love listening to the science, but just try to remember, if you're not incorporating flax seeds into your regimen, you might want to consider doing that. Anyone have any questions on this?
That needs to be ground, right? Ground seeds.
Correct, because if you don't grind them, the flax seeds just go right through your body and you don't get the benefits. So do you have to have a nut grinder? No, you can grind them by hand in a mortar pestle kind of fashion. Yes, Susan.
Yeah, well, that's kind of new information to me, because I wasn't sure that once the flax seeds were in baked goods, if they still had the same effect, and it sounds like they do.
It does.
Yeah,
Now,
definitely.
do you want to have baked goods? You don't have to have baked goods. We
Right.
get our flaxseed by grinding it and throwing it in our oatmeal or groats or whatever cereal we have, or throwing it on lettuce, salads. And that works just as well as having to bake with it.
Already ground, is that okay?
What?
How about already ground versus grounding it yourself? Is that
Oh,
okay?
yeah.
Already
Well-
ground is fine. It just spoils more quickly. So that's already ground. The name of it is flax meal, MEAL. And it lasts, I think, for about a month in the refrigerator. So keep a refrigerator, where seeds can last for months and months at a time. And then if you just grind them intermittently, they're kind of
Right.
fresher.
And
Yeah.
I buy my ground flax meal. I get the Bob's Red Mill. It's in the refrigerator section at Fred Meyer. I usually buy a bag of that, and I usually go through a bag in about a month, so it works out just right for me.
Yeah. And a coffee grinder works real good for if you mill them yourself. I usually do that every couple of days.
Yeah, you can use a nut grinder. There are some coffee grinders that you can use. You just need to have blades that kind of get down low enough to be able to do what you need.
Yeah, bullet works too.
Yeah, a bullet would work too. Okay, let's go on to the
Thanks.
next video.
Hey guys, I keep my ground ones in the freezer, if anyone didn't say that, but
No one
they
did.
don't
But
freeze and I just scoop it out. So I think it stays better longer.
Good thought. Thanks, Velvet.
You're welcome.
Anybody else? Okay. Ever onward, just unmute yourself and speak away. It's okay. Which spices fight inflammation? I think we're all interested in this. I hope.
Once in a while, I come across a study that's so juicy I do an entire video about it. It's like my which fruit fights cancer better video, or the best cooking method one, or that one comparing thousands of foods. Well, this is one such study. A group of researchers at U of F, Gainesville, and Penn State set up an elegant experiment. We've known ounce per ounce that herbs and spices have some of the greatest antioxidant activities known, but that's in a test tube. Before we can ask if an herb or spice has health benefits, it's first necessary to determine whether it's bioavailable. This has never been done until now. They could have went the easy route and just measured the change in antioxidant level in one's bloodstream before and after consumption, but the assumption that the appearance of antioxidant activity in the blood is an indicator of bioavailability has a weakness. Maybe more gets absorbed than we think, but doesn't show up on antioxidant tests because it gets bound up to protein or cells, so they attempted to measure physiological changes in the blood. They were interested in whether absorbed compounds would be able to protect white blood cells from an oxidative or inflammatory injury, whether it would protect the strands of our DNA from breaking when confronted by free radicals. They also wondered if the consumption of herbs and spices might alter cellular inflammatory responses in the presence of a physiologically relevant inflammatory insult. What does this all mean? Well, what they did was take a bunch of people and had each of them eat different types of spices for a week. There's so many really unique things about this study, but one was that the quantity that study subjects consumed was based on the usual levels of consumption in actual food. Like, the oregano group was given a half teaspoon a day, the kinds of practical quantities people might actually eat once in a while. Then at the end of the week, they drew blood from the dozen or so people they had adding black pepper to their diets that week, and compared the effects of their blood to the effects of the blood of the dozen on cayenne, or cinnamon, or cloves, or cumin. They had about 10 different groups of people eating about 10 different spices. Then they dripped their plasma, the liquid fraction of their blood, onto human white blood cells in a petri dish that had been exposed to an inflammatory insult. They wanted to pick something really inflammatory, so they chose oxidized cholesterol, which is like what you'd get in your bloodstream after eating something like fried chicken. So they jabbed the white blood cells with oxidized cholesterol and then measured how much TNF they produced in response. Tumor necrosis factor is a powerful inflammatory cytokine, infamous for the role it plays in autoimmune attacks like inflammatory bowel disease. Compared to the blood of those who ate no spices for a week, was the blood of those eating black pepper able to significantly dampen the inflammatory response? No. What about any of these other spices? Cloves, ginger, rosemary, and turmeric were able to significantly stifle the inflammatory response. And remember, they weren't dripping the spices themselves on these human white blood cells, but the blood of those who ate the spices. And so it represents what might happen when cells in our body are exposed to the levels of spices that circulate in our bloodstream after normal daily consumption. Not megadoses in some pill, just the amount that makes our spaghetti sauce taste good, or our pumpkin pie, or curry sauce. There are drugs that can do the same thing. Tumor necrosis factors are such major mediators of inflammation and inflammation-related diseases that there are these TNF-blocking drugs on the market for the treatment of inflammatory diseases like osteoarthritis, inflammatory bowel disease, psoriasis, ankylosing spondylitis, which rake in collectively more than $20 billion a year, because drug companies charge people $15,000 to $20,000 a year for the drug. At that price, the side effects better be hugs and rainbows, but no, these drugs carry a black label warning because they can cause things like cancer, heart failure. If only there were a cheaper, safer solution. Curcumin, the yellow pigment in turmeric, a spice that's a tad cheaper and safer, but does it work outside of a test tube? There's evidence that it may help in all the diseases for which TNF blockers are currently being used. And so with healthcare costs and safety being such major issues, this golden spice turmeric may help provide the solution.
Okay, let's stop that for a moment and see if we have any questions about this. Do you remember the 4 spices that are really good for cutting down on inflammation? Cloves, ginger, rosemary, and turmeric, or curcumin. So maybe you'll start incorporating those a bit more into the foods that you're eating, particularly if you're having problems with arthritis or other autoimmune or anti-inflammatory or inflammatory illnesses. Any questions from anyone or thoughts about this? You don't have to do this in humongous amounts. Just do it in amounts that make your food taste just a little bit better. Okay, I'm waiting for a hand. I don't see any, but you can unmute. Go ahead.
I just want to say, I know
Susan?
you've said this before many times, but just for people who may not have heard it, be sure and put a little black pepper when you're turmeric.
Good thought. So whenever you're having turmeric, put a pinch of black pepper with it, because you get much better absorption. So it has much higher impact. Thanks for adding that, Susan.
Yeah.
When you say inflammation, what do you mean, like arthritis or?
Yeah, arthritis, inflammatory bowel disease. We mentioned rheumatoid arthritis already. Could be lupus, other autoimmune disorders, psoriasis. There are so many problems which are inflammatory, even asthma, pneumonia, COVID, viral illness. It's good to incorporate this into your daily routine, so that it wards off the evil spirits in so many ways.
And if I could, I just want to say that I put a little bit of cloves in with my chai tea, and it not too much, but it adds some good flavor too. So it's a way of putting cloves in there every day.
Well, thanks for sharing that, because that's why we have these classes, so that people can hear this and they say, hey, maybe I'll try that. It sounds good to me, a little clove. Gives it a little different flavor.
Yeah, the turmeric tablets are okay. They're just more expensive. I know, like at Costco, they have the turmeric capsules with black pepper. So it actually comes with the black pepper. So that's that's actually a thing. So, but it's just a lot more expensive if you buy it in the capsules. But and then if you just put it on a quarter teaspoon or something on your whatever you're cooking that's savory. And then someone asked if there was. Oh yeah, go ahead.
Go ahead.
Yeah, I think it's got high omega-3 value too, so potentially it could have some of the similar benefits as flax, but I just don't know if there's been good randomized controlled trials on chia versus flax. So that might be the main reason.
Yeah, I think that Gregor promotes doing flax because of that. And he does say that chia seeds do have omega-3s, but maybe not quite as much. But if you don't like flax, do chia. Actually, do more. Remember, the more different kinds of foods you eat for the week, the more diverse your microbiome will be, and healthier you'll be. All right, let's go on to the next one. If we can do the share screen a bit again. And why do plant-based diets help rheumatoid arthritis? And then we'll see what Gregor has to say about that. I think it's Gregor.
Rheumatoid arthritis is a chronic systemic autoimmune disease affecting millions, characterized by persistent pain and stiffness and progressive joint destruction, particularly in the hands and feet, leading to crippling deformities. What can we do to prevent it and to treat it? In a famous 13-month-long randomized controlled trial of plant-based diets for rheumatoid arthritis, patients were put on a vegan diet for 3.5 months and then switched to an egg-free lacto-vegetarian diet for the remainder of the study. Compared to the control group that didn't change their diet at all, the plant-based group had a significant improvement in morning stiffness within the first month, cutting the number of hours they suffered from joint stiffness in half. Pain dropped from 5 out of 10 down to less than 3 out of 10, a drop in disability. They reported subjectively feeling better, significant improvements in their grip strength in their hands, fewer tender joints, less tenderness per joint, less swelling, with the added benefit of losing about 13 pounds and keeping most of that weight off throughout the year. They also had a drop in inflammatory markers in their blood, SED rate, C-reactive protein, white count. The question is why? What does diet have to do with inflammatory joint disease? Well, rheumatoid arthritis is an autoimmune disease in which your body attacks the lining of your own joints. Why would it do that? Well, there's a different autoimmune disease called rheumatic fever, in which your body attacks your own heart. Again, why would it do that? Well, it appears to be a matter of friendly fire. Rheumatic fever is caused by strep throat, which is caused by a bacteria that has a protein that looks an awful lot like a protein in our heart. So when our immune system attacks the strep bacteria, it also attacks our heart valves, triggering an autoimmune attack by molecular mimicry. The protein on the strep bacteria is mimicking a protein in our heart, so our body gets confused and attacks both. That's why it's critical to treat strep throat early to prevent our heart from getting caught in the crossfire. So researchers thought maybe rheumatoid arthritis might be triggered by an infection as well. A clue to where to start looking was the fact that women seem to get rheumatoid arthritis 3 times more frequently than men. What type of infection do women get more than men? Urinary tract infection. So researchers started testing the urine of rheumatoid arthritis sufferers, and lo and behold, found this bacteria called Proteus mirabilis. Not enough to cause symptoms of a UTI, but enough to trigger an immune response. And indeed, there's a molecule in that bacteria that looks an awful lot like one of our own molecules in our joints. So anti-Proteus antibodies against the bacteria may inadvertently damage our own joint tissues, leading eventually to the joint destruction. Therefore, therapeutic interventions aimed at the removal of this bacteria from the bodies of patients with consequent reduction of antibodies against the organism should lead to a decrease in inflammation. Well, as we saw before, urinary tract infections originate from the fecal flora. The bugs crawl up from the rectum into the bladder. And so how might one change the bugs in one's colon? By changing our diet. Some of the first studies over 20 years ago on trying to fundamentally shift people's gut flora were done using raw vegan diets, figuring it's about as fundamental a shift from the standard Western diet as one can get. And indeed, within days, one could significantly shift someone's gut flora. And you put rheumatoid arthritis sufferers on that kind of diet, and they experience relief. And the greater improvements were linked to greater changes in their gut flora. But the diet was considered so intolerable that half the patients couldn't take it and dropped out, perhaps because they were trying to feed people things like buckwheat beetroot cutlets buttered with a spread made out of almonds and fermented coconut juice. Excuse me, not coconut, that might have been good, cucumber juice. Thankfully, regular vegetarian and vegan diets work too, changing the intestinal flora and improving rheumatoid arthritis. But we didn't specifically have confirmation that plant-based diets brought down anti-protease antibodies until now. Those that responded to the plant-based diet showed a significant drop in anti-protease mirabilis antibodies compared to the control group. Maybe just dropped immune responses across the board? No, antibody levels against other bugs remained the same. So the assumption is that the veg diet reduced urinary or gut levels of the bug. A shift from an omnivorous to a vegetarian diet has profound influence on the composition of our urine. For example, higher levels of lignans in the urine of those eating vegetarian. Up until now, it's just thought that they protected people eating more plant-based from getting cancer. But now we know lignans can also have antimicrobial properties as well, so maybe helping to clear protease from our system. Either way, this suggests a new type of therapy for the management of rheumatoid arthritis. This new treatment includes anti-protease measures such as dietary manipulations in the forms of vegetarian diets.
So I have a story to tell you about rheumatoid arthritis. The story goes like this. Back in March, I was working in a clinic, a volunteer clinic, and a man came in with rheumatoid arthritis, and he'd been taking methotrexate injections on a weekly basis to resolve his symptoms, and he'd been on prednisone for a couple years. Well, I talked to him about, had any doctor ever approached him about changing what he chose to eat in an attempt to get off of his medicine? He was under the assumption that he was going to be on these medicines for the rest of his life. So he said he was interested in doing that. So I had him download Dr. Greger's Daily Dozen. He seemed excited about doing something different with his life, and he jumped in feet first, or mouth first, and he began eating totally whole food plant-based. His pain symptoms completely cleared, even though he was having some discomfort before I had talked with him. And we began tapering his prednisone. And just this last week, he finished tapering off of all of his prednisone. No pain, no arthritis pain. And so the next drug that we're going to be tapering on him is methotrexate. So needless to say, he was pretty excited about the fact that at least one of the medicines that he had been needing to take potentially for the rest of his life, he no longer had to take because of a change in what he was choosing to eat. I don't know if any of you have had a similar experience or know of anybody, but these are things which I knew nothing about 11 years ago, had no training at all, that food as medicine could actually help people with rheumatoid arthritis. And hopefully this last video kind of showed you a demonstration of why people have autoimmune diseases and the body attacks itself when it has a foreign invader. And if you kind of get rid of that foreign invader, you can kind of calm things down potentially. And of course, if you get rid of some of the things that are causing inflammation in your body, you also can get rid of some pain just on that basis. Any thoughts from anyone else? As I recall, not a lot of people had rheumatoid arthritis in our last classes, but some people do. So, Patricia, go ahead.
I have a rheumatoid arthritis, and I take pills from my doctor for them. And I don't know. I was doing the plant-based diet. I was pretty well involved. I wasn't perfect, but I was doing it. And then I had a really bad flare-up, and I was taking prednisone for it, and I broke my ankle, and I just thought, I'm taking the drugs because it just seemed like that would help me more than so I do both. I tried to do both. I'm not 100%, but I try to do both. I take the drugs and I also do the plants.
Yeah, so we're not policemen and we don't give tickets for anybody who doesn't do this 100%.
Mm-hmm.
We just kind of share with you some of the experiences that we've had. And this person who's getting off of the prednisone has been doing this 100%. There is no yielding. And I explained that to him at the time. If he really wanted to get the maximum benefit, he would need to do this completely. And for some people, that's an acceptable way of leading their life. For other people, it's not. So everybody gets to choose for themselves. And it is a choice that you get to make for your life also.
Right.
Yeah,
So
and some of the other factors. I was just
Go
going to say
ahead.
some of the other factors too that are important with autoimmune diseases. Pretty much all of them is your other lifestyle factors. So even if you have the food right, if you're still not getting enough sleep or exercise or stress, you're not working on those other parts of your life, social support and all those things that can have a big effect too on inflammation. So, so besides the food, all those other things.
I do meditate, and I feel like I get enough sleep, and I work in a place where I feel the camaraderie of my fellows. And so I don't really know, I'm just listening.
Yeah, well, that's why we have these classes, and that's why we have the medical students who, if you want to have some free one-on-one sessions with a med student who can kind of discuss this with you and kind of, sometimes it can be motivating to help you stay on track. Some people choose to do this completely for a full month or two to give themselves, do an experiment on their body to see if it really makes a difference. And other people choose not to. So we just wanted to remind you that that is available, and we can hook you up with someone if you're interested at some point in the future.
Okay, thank you.
You're welcome. Anybody else? All right. Again, if you just unmute at any time, I'll kind of stop what I'm doing. In the meantime, there's another video. They keep going on and on. Some people do fasting for rheumatoid arthritis. And so we might as well share that video with you so you can see that it can be beneficial at times. And then we're going to get into fibromyalgia for the next couple videos. And then we'll skip into thyroid issues. So let's do the fasting for rheumatoid arthritis first.
They'll tell you, you'll be on these medications the rest of your life. That's them, in effect, promising you, if you follow their advice to the letter, you...
Hey, Charlie, the
sit.
video's not showing.
Preliminary...
Oh, thank you.
You're welcome.
Let's see why it's not showing. I have my share screen on. Can you see the screen right here? Let's see. I'm going to share it again. Share screen. You see this?
Yeah, we see your selection of videos, but when you clicked play, it didn't show us the video. Now we see it.
Not generally recognized by the medical profession as one of the weapons with which to attack such diseases.
Yes or no?
Yes, we see it.
Okay.
This attitude persisted until relatively recently, but a systematic review of controlled trials has since shown a statistically and clinically significant beneficial long-term effect. Rheumatoid arthritis has a well-known genetic component, but the concordance rate, the chance that a pair of identical twins both get it when one has it, is probably under 30%, despite having the same genes, leaving 70% to be explained by non-genetic factors. Even if we don't know exactly what those factors are, fasting has been compared to rebooting the hard drive in a computer. Sometimes a drive gets corrupted and you don't know exactly what the problem is, but if you just turn it off and reboot it, that corruption may get cleared out. The evidence base started with case reports, fasting followed by a plant-based diet. Remarkable reports of years of pain and stiffness gone within a week, and more importantly, stayed gone on the healthier diet. One after another like that, but case reports are just glorified anecdotes. There have been studies going back decades suggesting fasting may represent the most rapid available way to induce relief of arthritic pain and swelling for patients who have rheumatoid arthritis, but the studies often failed to have control for the placebo effect, which is especially important when it comes to relying on self-reported subjective symptoms such as pain and general well-being. But there are objective measures, lab tests of inflammation that don't appear to be affected by placebos, and that's what you can see in controlled trials, starting immediately and remaining down for at least a year. 10 different measures of inflammation significantly decreased after the fasting and subsequent meat and egg-free diet, whereas none of the parameters budged in those disease victims that continued to eat their regular diets. And the squelching of inflammation translated into a significant reduction in pain, morning stiffness, a loss of grip strength, and number of tender and swollen joints. Even a year after the trial was over, those who benefited from the diet continued to benefit in terms of pain, stiffness, tender and swollen joints, presumably because they stuck with it. There's little doubt that while fasting, both inflammation and pain are relieved. But if you go back to the same diet you were on before, the inflammation returns unless, evidently, the fasting period followed by a vegetarian diet. Why might that be? Well, it could be due to the changes in the microbiome. The improvement in symptoms coincided with a significant alteration of the intestinal flora, which may somehow be beneficial, perhaps by strengthening the gut barrier. We know fasting can decrease the leakiness of the gut in rheumatoid arthritis patients, but we don't yet know what role, if any, it plays in the disease process. It could be as simple as eicosanoids, the mediator of inflammation that are formed from arachidonic acid. Arachidonic acid is a long-chain inflammatory omega-6 fatty acid found in animal fats. The biggest contributors are chicken and eggs, which together contribute nearly half of American intake. That's been suggested as an explanation of why those eating more plant-based appear to have better mental health. They're not suffering the cascade of neuroinflammation caused by arachidonic acid. Why removing eggs, chicken, and other meat was shown in a randomized controlled trial to improve mood, suggesting the arachidonic acid might be negatively impacting mood states, and may help explain the impact of more plant-based diets on inflammatory diseases like rheumatoid arthritis. So that may help explain why maintaining a plant-based diet appears to be necessary after the fast to prevent the recurrence of symptoms and inflammatory activity. Or as one popular press article put it, fasting may just be a tool to get you to radically kickstart a change in the way you eat.
So for those of you who might be interested, the name of this video from Gregor, it's on nutritionfacts.org, is Fasting for Rheumatoid Arthritis. And if you have rheumatoid arthritis, taking medicines for it, you may want to go to that. You may want to talk with Goldhammer in Northern California. And, hey, who wants to have pain for the rest of their life and have to take pills? Any thoughts from anyone?
How do you define fasting? Like how long and exactly what do you do during that time? Is it water only or what?
I'm not sure what the protocol is at North. Do you know, Scott? I know you're getting unmuted there. I know you're on your phone, I guess, instead of your computer. There you go.
You can hear me now?
Yeah.
So what was it? What was the question?
The question was, how long is the fast? What do you do? Is it just water only, like at North? Do you know what their protocol is?
Yeah, so it's water only fasting. They give some vitamins depending on how long you do the fast for. So it's all medically supervised. So they do blood work on you beforehand and monitor your blood work throughout. And some people do anywhere from 4 days up to 60 days. So there's sometimes really prolonged fasting, but those are for people that are really sick. People that have cancer, really bad high blood pressure. People that are kind of really down and out, and it's kind of last resort kind of stuff for most of the patients that are seen at True North. And then when you refeed, you get fed a whole food plant-based diet.
Somehow I'm thinking for someone with rheumatoid arthritis, 3 to 5 days, perhaps.
Yeah, if it's medically supervised, I would just, wouldn't recommend anybody fast more than 24 hours unless they're under the care of their medical provider, because it could get into some trouble, especially if you're on medications or you have diabetes, things like that. There's certain people that shouldn't fast for prolonged periods. But things like time restricted feeding, which is a type of intermittent fasting, is safe, where that's where you say you eat during an 8-hour window and fast for 16 hours, for example. And we will have a whole class on fasting later on in the fall.
I personally don't like to fast, so my choice would be to do this 100% for a couple months and see what happened. See if that experiment would actually improve my symptoms. And then if that didn't work, then I might yield and say, okay, in order for me not to have to take the medicines, maybe I need to consult with Goldhammer and do that fasting thing. That's my thought.
Hey, Charlie.
Yes, Velvet.
So one of my best friends has rheumatoid arthritis. She's 30 years old. She's already had a hip replacement. She's looking at maybe a possible shoulder replacement. And, I've, of course, told her about plant-based, and she's on board. She was vegetarian for about a year. but she's trying, but she's also struggling, and she's about to start a master's program. She has 2 kids. She's a single mom, so it's a lot to just up and change everything. But she's in a lot of pain all the time. And so I bought her a book, Your Body on Fire by Monica Agarwal. But so she's reading that and she's interested. But I would really like to know about your patient. And if he stays off prednisone for the next few months, it would be interesting to be able to tell her that, because she's been on prednisone probably off and on for about a year now. And I think she does methotrexate or something. And she's tried almost all the rheumatoid medications, the different injections, infusions. It's awful. But I'd be interested, so.
Yeah, the other thing I'd recommend, Velvet, it sounds like she has a pretty severe, a lot of suffering from this. Maybe getting a consult with Goldhammer in at True North in Northern California.
Okay.
It
It's in
surely
Santa Rosa.
might be worth it. It's Santa Rosa.
Uh-huh.
And it could make a huge difference, when someone isn't suffering with pain all the time in their overall life experience.
Yeah, it's awful, and her quality of life is really suffering. She's so young, and she has 2 very young kids. So, but anyways, I'll check in with you every once in a while and see how the patient's doing, because it might give her a little bit of like push to be like, okay, I really want to try this.
Yeah, and it is awkward for some people.
Mhm.
They've got a lot of pressure from their family or their friends or whatever it is. They don't get enough protein, they're told. They're going to get sick doing this. So it's not an easy transition for everybody to make. And that's why we have these classes every single week to keep encouraging people along.
Yeah. Well, thank you. Have a
Thank
good
you.
night, guys. I'm going to go for a walk.
Okay, Velvet, enjoy it.
Bye.
Okay, let's carry on to we're going to fibromyalgia next. So I'm gonna share my screen. And it's aspartame induced fibromyalgia. Now the aspartame is a sweetener, artificial sweetener. If you didn't know that, in the little blue packet usually.
Reported for the first time recently case reports of aspartame-induced fibromyalgia, an unusual but curable cause of chronic pain. 50-year-old woman had been suffering from widespread pain fatigue for more than 10 years, leading to the diagnosis of fibromyalgia. But during a vacation in a foreign country, she did not suffer from painful symptoms and made a connection with the fact that she had forgotten to take her aspartame. All the symptoms reappeared in the days following her return when she reintroduced aspartame into her daily diet, but when it was definitively excluded from her diet, resulted in a complete regression of her fibromyalgia symptoms after 10 years of suffering. 43-year-old man consulted for a 3-year history of bilateral forearm, wrist, and hand and neck pain, various unsuccessful treatments. A detailed questioning followed to find out that he had been taking aspartame for 3 years. The removal of aspartame was followed by a complete regression of pain without recurrence. The benefit-risk ratio of considering the diagnosis of aspartame-induced chronic pain is obvious. The potential benefit is to cure a disabling chronic illness, right? To spare numerous laboratory and imaging investigations, and to avoid potentially harmful therapies. The potential risk is what? To temporarily change the patient's diet? Thus, practitioners should ask patients suffering from fibromyalgia about their intake of aspartame. In some cases, this simple question might lead to the resolution of a disabling chronic disease. And fibromyalgia is no small pain in the neck, affecting an estimated 5 million Americans who should all be asked that simple question.
So again, when you stray from eating foods as they're grown in nature by inducing artificial foods and sugars, one must be leery of what might happen. And let's listen to this last video here on fibromyalgia.
Raw vegan diets seem to really help reduce fibromyalgia symptoms. But what about just a mostly raw diet? That was tried next. Fibromyalgia engulfs patients in a downward, reinforcing cycle of unrestorative sleep, chronic pain, fatigue, inactivity, and depression. So they tested whether a mostly raw, and actually vegan diet, would significantly improve fibromyalgia symptoms, and boy did it. FIQ is the standard survey designed specifically to measure the impact of fibromyalgia on a person's life. At the beginning of the study, they were doing pretty bad. By 2 months, though, they were doing significantly better, and by the end of the study, at 7 months, there were significant improvements in each one of these measures, so less physical impairment. They were feeling better, less absenteeism, less pain, fatigue, stiffness, anxiety, depression. In summary, a diet intervention using a mostly raw, pure vegetarian diet produced dramatic improvements in fibromyalgia syndrome symptoms. When this study was reviewed by Current Rheumatology Reports, the editor noted that it had the most impressive results of any recent fibromyalgia treatment study. For example, nearly 3 times the improvement that the Mayo Clinic reported for their fibromyalgia program. Yes, it was not a double-blind, placebo-controlled study, but as they note, it's difficult to design such a study when it comes to diet, since people tend to notice when they've switched to a vegan diet. So, raw vegan diets worked. Mostly raw vegan diets worked. Even just eating vegetarian seemed to help. What about just eating mostly vegetarian? That was the one tried most recently. Fibromyalgia symptoms put on a mostly vegetarian diet for 2 weeks and did not see any significant improvement. Maybe if they gave it more time, we don't know. Bottom line is that the best available science to date suggests eating plant-based diets, whether vegetarian or vegan, may help people with fibromyalgia. Just because the best science we have doesn't mean it's necessarily very good science, right? These were all very small, poorly controlled, relatively short-term studies. But what's the downside of giving it a try? It turns out that people with chronic widespread pain syndromes tend to eat pretty crappy diets, perhaps explaining their higher rates of other chronic diseases such as cancer and cardiovascular disease. So even if a healthy diet doesn't help their fibromyalgia symptoms, at least it may prevent them from falling ill with something else. The last thing someone who feels miserable all day needs is another disease.
Just another good reason to consider whole plant foods. Now, we did talk about osteoarthritis the last time, and so I have one more video to share with you before we do hypothyroidism. It's the best knee replacement alternative for osteoarthritis. This is an important one. Lots of people have it.
The largest study in history on the health effects of being overweight, analyzing data from more than 50 million people from nearly 200 countries, found that excess body weight accounts for the premature deaths of about 4 million people every year. Most of these deaths are from heart disease, but the researchers found convincing or probable evidence linking obesity to 20 different disorders, a veritable alphabet soup of potential health concerns. In the ABCs of health consequences, A is for arthritis. Obesity can make rheumatoid arthritis worse and increase the risk of another inflammatory joint disease, the so-called disease of King's gout. The most common joint disease in the world, though, is osteoarthritis, and obesity may be the main modifiable risk factor. Osteoarthritis develops when the cushioning cartilage lining of joints breaks down faster than your body can build it back up. The knees are the most commonly affected, leading to the assumption that the relation to obesity was simply the excess wear and tear from the added load on the joints. But non-weight-bearing joints like the hands and the wrists can also be affected, suggesting the link isn't purely mechanical. Obesity-related dyslipidemia may be playing a role, with elevations in the amounts of triglycerides, fat, and cholesterol in the blood, aggravating inflammation in the joints, just like cholesterol can aggravate the inflammation in your artery walls. Osteoarthritis sufferers not only have higher cholesterol levels in the blood, they have higher cholesterol levels within their joints, both in aspirated joint fluid and in the cartilage itself. Drip cholesterol on human cartilage in a petri dish, and you can worsen the inflammatory degeneration, helping to explain why the higher people's cholesterol, the worse their disease. Cholesterol-lowering statin drugs may both help prevent and treat osteoarthritis, as can a cholesterol-lowering diet. A healthy enough plant-based diet may offer the best of both worlds, dropping cholesterol as much as a starting dose of a statin drug within a single week, and only has good side effects such as lowering blood pressure and facilitating weight loss. Even just losing about a pound a year over the span of a decade may decrease the odds of developing osteoarthritis by more than 50%. Weight reduction may even obviate the need for knee replacement surgery. Obese arthritis sufferers randomized to lose weight improve their knee function as much as those going through surgery within just 8 weeks. The researchers concluded that losing 20 pounds of fat might be regarded as an alternative to knee replacement. I mean, isn't it easier to just get your knees replaced than lose 20 pounds? Rarely discussed is the fact that nearly 1 in 200 knee replacement patients die within 90 days of surgery. Given the extreme popularity of this operation, about 700,000 a year in the U.S., an orthopedics journal editor suggested that people considering this operation are inadequately attuned to the possibility it may kill them. Arguably the single most salient fact to share with a patient considering the operation. An orthopedic surgeon responded questioning whether patients should be told about the chance the operation may kill them. Quote, "To me, the real question is whether this knowledge will help the patient. Will it add to the anxiety of the already anxious patient, perhaps to the point of denying that patient a helpful operation? Or will this knowledge motivate a less handicapped patient to stick to a diet and physical activity regime?" Ultimately, then, the question boils down to the surgeon's judgment, unquote. Even among the vast majority who survive the surgery, approximately 1 in 5 knee replacement patients describe being unsatisfied with the outcome. Weight loss with a healthy diet, on the other hand, may offer a non-surgical alternative that instead treats the cause and offers only beneficial side effects.
That's a pretty impressive video about osteoarthritis and knee replacement, and I'm always surprised when I hear that number, 1 in 200. Seems like a lot. But, something to contemplate when you're thinking, how am I best going to treat this osteoarthritis? Should I be really changing what I eat and not having any side effects other than weight loss, or should I have this surgery?
What he didn't say was, why are they dying? What's causing those 1 in 200 to die?
Yeah. My guess is probably mostly infections and blood clots. So probably like you can get an infection in the wound, and that can cause sepsis, which can shut your kidneys down and things like that. And then also, the pulmonary embolism. So you have a blood clot from the surgery, and that gets thrown into your lungs, and that can kill you. That would just be an educated guess on most of the causes.
Something that's not, we're supposed to be getting advice before a surgery, which gives us informed consent. And it's not so easy. to give a patient informed consent by discussing the possibility that they may suffer disability or death because of the surgery. Surgeons, some of them are reluctant to mention that, and even if they do mention it, it's generally mentioned very quickly in passing, so that it doesn't frighten or scare a patient away from potentially doing this. There are different ways of advising people, and so a lot of this is dependent upon who the surgeon is who's giving you the advice as to whether you're really getting informed consent or not about a particular procedure.
And then just to play devil's advocate, I'll say that, let's just say you decide to get your knee replaced and you weren't going to change your diet. So you weren't going to, go on a plant-based diet, get exercise, do the weight loss, basically what Dr. Gregor was talking about in the video, and you didn't get the knee replaced because of that 1 in 200 chance of dying from the surgery. There would be numbers that you could, I don't know the exact numbers, but would be certainly higher chances of death, mortality causes from not getting it. So let's just say you didn't get the surgery, and so then you couldn't exercise, so you're really sedentary, and so you're socially isolated because you're not getting out, because you can't walk very much or get around because your knee, and so that would have a health risk too, because you could end up be more likely to have a heart attack or a stroke or die from chronic diseases because you're not engaging with other people, you're not getting exercise, things like that, and then just being the consequences of being too sedentary, I should say. So just throwing that in there as being devil's advocate on it, just to be fair and balanced.
We love you to play the devil every so often, or at least the advocate. All right, we're going to go over hypothyroidism as a next step. So let's go on to the thyroid issues. There's a couple videos. Both of them are Healthy Thyroid, the Secret Ingredient, and Balancing Thyroid Hormones with a Plant-Based Diet. Both of these are from Dr. Neil Bernard. And you may want to get his book, Hormones in Balance, or maybe not. Maybe you just want to think about this a little bit more. So let's start this one at about 8 minutes. It's a podcast, and I'm getting there pretty quickly. Can you see my screen?
We just see a blank screen.
It's still a blank?
Yeah.
That's bizarre.
There we go. Now we see your choice.
All right, let's try this again.
Yeah, it's still just a blank screen.
Huh?
Yeah, it's still just this kind of gray blank screen.
Really? All right. Please remove this away from the shared, move this window away from shared application. I don't know. Let me try this one then.
Same thing.
Same thing?
Yeah.
Well, why is that? How are you supposed to know?
Same thing.
And it's blank still?
Yep.
Okay. Is this still blank?
Yep.
Well, I'm sorry about that. I guess we're just going to have to discuss hypothyroidism and hyperthyroidism. So screen stop sharing and let's talk about it. So, you have your thyroid gland right here at the base of your neck. And sometimes you need certain ingredients that allow you to produce thyroid hormone. One of those major ingredients, as we've talked about in many classes, is iodine. And many of you are on salt-free diets, so you've kind of given up salt for high blood pressure reasons or whatever it might be. And when you give up all the salt, you give up oftentimes all the iodine sources that you have access to, because usually we add iodine into salt, not always, but it says iodized salt on the package or on the container that you're using. Many salts don't carry iodine in them, like Himalayan salt and some of these other fancy food salts that are used. Now, you can get iodine from other sources. One of the major sources would be sea vegetables. And so things that come from the sea, if you're used to eating fish, then perhaps you get some iodine from fish also. But you can do, you also get mercury and dioxin, which are some poisons associated with the fish and the fat associated with it and the animal protein, which aren't particularly healthy choices. But if you choose to eat sea vegetables, and we're talking about dulse or nori or wakame, these are like seaweed that's low on the food chain, and they have iodine in them, and they have omega-3s, so they have significant benefits. And if you're like me, the first time you try it, you'll say, I don't want to eat this ever again. It was so gross. When I had my first taste of dulse, I was like, this is not something I'm going to live with. And then I listened to Gregor some more, and he said, these are the benefits. If you want them, you learn to eat it. And sometimes it takes exposure of 10, 12, 15 times to be exposed to a food until you start thinking it's a food. And so I stuck with it. And now I kind of crave eating dulse every day with the steamed greens that my wife makes. But I must tell you, it was a challenge. Those first few attempts were not pleasant, but I used my brain to kind of overcome my displeasure with what to me was kind of a gross taste, and like I didn't want it. And now it tastes a little like old bacon does or something like that. Now, some people get along a lot better with nori. Some people do okay or better with wakame. There are different kinds of wakame. Some of them come in kind of like big leaves, and it's mushy, and it's like an overcooked mushroom. And to me, that's kind of gross. But if you buy it where it's small, cut up in little chunks and dehydrated, it fits well in soups and salads, and it's actually quite tolerable, and it has the most amount of omega-3. So if you're just starting out trying to get enough iodine, I'd encourage you to think about doing some wakame on a regular basis, maybe a teaspoon a day. Start with a quarter of a teaspoon or just a few little nibbles of it initially, and keep trying it until you get there. Or Dr. Gregor recommends doing a bag. It's, I think, a 1 ounce or 2 ounce little baggie of dulse once a month. And the dulse actually is pretty tasty. Cut a little strip and put it in steamed greens, or put it in a smoothie or whatever you want. You'll get used to it over time. You can put it in soups, and you'll get iodine. Now, you also may want to do what others have done, and that's take an iodine tablet. You need about 150 is it micrograms?
Yeah, 150 micrograms. Yeah.
Of iodine on a daily basis on the average. And you can get iodine tablets and not have to worry about eating this seaweed or sea vegetable, or not having to add salt. So that's the first thing. And when people say to me, if I do a whole food plant-based diet, will I be able to get off of thyroid medicine? I say, if the reason you're on thyroid medicine is because you weren't getting enough iodine, and you add iodine into your diet, then you retest yourself and your levels are doing fine, you could taper the medicine down and see whether your body's making enough. So there are ways to deal with hypothyroidism. Hyperthyroidism, the overactive thyroid, is a different story. doing a diet. I haven't seen anybody who can reduce their thyroid function by eating goitrogens or huge amounts of, let's say, kale or some of the foods that supposedly suppress thyroid function. You'd have to eat way more than most people could eat. And so that's going to take some medicine to knock out your overactive thyroid. Does anybody have any specific questions about thyroid disease that they have in mind?
The other thing you might add is that, you know, there's a type of autoimmune disorder called Hashimoto's thyroiditis. And so Hashimoto's is basically your immune system attacks your thyroid and suppresses it, kills off your thyroid. And then most of the time when that happens, then you have to be on a thyroid supplement for life. But there are published case control studies of people that, because of, you know, eating a whole food plant-based diet and all the other lifestyle factors that we've been talking about over the last 2 weeks for autoimmune disease, if it's your immune system, it's attacking your thyroid. Sometimes if you knock down that inflammation, treat the cause, you could actually gain some function of your thyroid back. And there are many case controlled studies that are published in the literature that show patients that were diagnosed with Hashimoto's thyroiditis and they're on a thyroid supplement even for years sometimes, and then when they changed their diet and lifestyle, they got their thyroid function back and were able to get off their thyroid medication. But in general, that's pretty rare. It doesn't tend to happen too often. So
bottom line, if you're taking thyroid medicine and you want to get off, you want to first evaluate, am I getting enough iodine? And if you're not, then you may want to try a trial of adding enough iodine, 150 micrograms once a day, however you get it, and then rechecking your thyroid function maybe 4 to 6 weeks down the road or 2 months, and then seeing what happens. And if it's not made any difference, then you're probably going to just keep taking your thyroid medicine. And if it has made a difference, maybe you'll be able to taper. Anybody had any experience with thyroid problems that they want to talk about some more? Remember, these meetings are for you, and we talk about what we like to talk about, but we like to talk about what you want to hear. Kim.
Hi. So I have I've been taking thyroid and I've been taking the supplements, or either the drops or the pills for the iodine, and I keep telling my doctor that I should be, you know, decreasing my thyroid medication, but she's increasing it, and she says that I have Hashimoto's, and I'm still following this diet. So I don't know why my numbers aren't going down. Is this just my lifelong thyroid issue then?
Well, that is most common. So most common, if you have Hashimoto's, it's not an iodine deficiency that's causing it, it's your immune system. And so if your doctor's having to increase your thyroid dosage, that just means because we follow something called TSH, which is thyroid stimulating hormone, and that is a hormone that's being released by the pituitary gland in the brain. And what that does is when your thyroid gland in your neck is not producing enough thyroid hormone, then the pituitary puts out more TSH, thyroid stimulating hormone. So it's basically stimulating the pituitary to say, hey, thyroid, make more thyroid hormone. And so when the TSH is high, that means we're worried your thyroid is still too low. And that's why we follow that TSH to dose the levothyroxine, the thyroid hormone medication. And so if it's Hashimoto's, and so you're getting enough iodine then if you're taking the supplement. And then, I mean, the only thing you can control then is your whole food plant-based diet and other healthy lifestyle behaviors. And if that isn't enough to bring calm your immune system down enough to let you regain your thyroid function, then you don't really have any control over that. If it's already been killed off too much and your thyroid gland just isn't going to make any thyroid hormone anymore because your immune system's destroyed it, then most of the time you can't get that back. But there have been many cases where people do get it back. It's just, again, quite rare.
So I guess my question is, I should still be taking the thyroid medicine and the iodine supplements.
Correct. If your TSH is in the normal range, then you'll have to stay on it. But if they ever you were to try it, you could go on lower doses of the thyroid hormone. And if your TSH still stays normal, then you're okay. So even if you could lower the dose until you can get off and it stays normal, then you're fine. But if as soon as you start going down on your dose, your TSH keeps going higher, that means that you're not producing the thyroid hormone, and you have to stay on it and stay on the higher doses.
But I should take the iodine.
Yeah, I mean, it's always good, just even someone that doesn't have thyroid problems, we all need to have enough iodine. So that's the recommended dietary allowance is 150 micrograms for everybody. Everybody needs at least that.
Okay, thank you so much. Thank you.
You're welcome.
You could do some iodized salt if you wanted to. And while they're following your thyroid function, the TSH, we're looking for values that are somewhere around the 2 range. So that's something when you're looking at your TSH value, if it's like up around 10 or 20 or 40, that means that you need to probably add some more thyroid into your life. But if it's down around 2, that's the kind of the value of TSH that we're shooting for. Doesn't have to be exactly 2. It could be 1 or 2.5 or 3.
Our reference range at our lab is between 0.5 and 5 is essentially normal. Somewhere in that range.
One other thing to mention is that you don't want to overtake iodine in your life. If you're getting a lot of iodine, that can cause an overstimulation and goiter, enlargement of your thyroid gland by taking too much thyroid. So you want to be like Goldilocks, just the right amount. I think it's Goldilocks. Who is it that is? Maybe it's the 3 bears. You want it just the right amount, not too much, not too little, just the right amount
of iodine. You said thyroid, but just the right amount of iodine is important.
There you go. It's a good thing we have Scott monitoring the conversation here. All right. Anybody else have any thoughts on this topic? Dave, do you have any specific things about thyroid that are kind of troubling you or that you have in mind? Unmute yourself first. There you go.
There. Oh, I have a question.
Yeah.
I was looking at the iodine pills on Amazon, and they're 130 milligrams or mgs, whatever that is.
Yep.
But in the description, it says don't take for more than 10 days.
130 milligrams, that's way too much. We want micrograms. 150 micrograms is what is the recommended dietary allowance of iodine.
It says mg. I don't know what that stands for.
That's just milligrams.
Mg is milligram.
That's huge. So that's a huge dose. So you wouldn't want to take that.
Oh, okay.
Too much.
So,
you want 1,000th of that amount.
okay. So that's the one you take if they drop the nuclear bomb, then, I guess.
Yeah, that's
it.
Right. Okay. Yeah, I don't have a pill splitter to get it to 1,000.
Okay, there you go. Good you asked that question because it is confusing. Milligrams and micrograms and all this stuff. And so I'm sure others could get confused with it also.
Thank you.
Anything else?
You want to ask anything? No? Nope, that's it. Thank you.
All right, you're welcome.
Oh.
Yeah, Susan.
Yeah, I was wondering, this stuff is Arame, A-R-A-M-E. Have you heard of it? It's edible ocean plant. Do you know anything about Arame? I don't know if you can see it. Arame.
Arame. I've never heard of it before.
Oh, it's a sea vegetable. And
And does it say how much iodine is in it?
Oh,
Maybe not.
I think, I think they neglect to put, no.
You may
You
want to
know,
call the company and
that's a good
ask
idea.
them, is it kelp? Because kelp is one that may have too much iodine. You got to be careful about that. I'm not sure what Arame is. Let me do a quick search.
It says an edible ocean plant, certified organic. And it's crunchy and it's real thin and kind of wavy.
Is that ARA?
Correct. ARAME.
Arame.
ARAME. I bought this for like a recipe one time, and it actually isn't like gross at all. I mean, it's crunchy.
It looks a little like, in my mind, like wakame.
Yeah,
with
it
that
does.
crunch that you have with
Yeah.
that. So I think it's probably okay.
I had some wakame and it is similar, very similar. Yeah.
Yeah.
Okay.
Probably
I mean, it's
fine.
dark green and everything.
Yeah.
All right. Thanks.
You're welcome. Anybody else?
Next week is a open forum, and I won't be there. I'll be riding my bike down the Oregon coast, so I'll be missing next week. So Charlie will be on his own.
So you want to tell them how far you're going?
Yeah, not very far. I mean, for me, my standards, not very far. Just about 4 days. So I'll probably get from Florence down to probably Crescent City. It's probably about as far, a couple of 100 miles or so, probably.
Well, we're hoping you have a good time and that the weather's good. It's going to be a little hot out there. How are you going to get enough water?
Well, actually, it'll be great on the coast. It's only going to be in the 70s, so it's a perfect time to go down the coast.
All right. Well, you deserve a break. Hope you have a wonderful time.
Thank you.
And we want to thank everybody for coming again tonight. And next week we'll be here and do an open forum, just have questions, and maybe I'll be able to get Barnard's video to play a little better. Who knows? It's a week by week thing in this world, it seems like, as to what works and what doesn't work, but we'll keep trying.
Then the week after that, I'll be doing the part 1 of our cancer classes. We have our 2 classes on cancer starting in 2 weeks.
And they are very important classes for sure. Very interesting too. Okay, everybody. It's been fun being with you all again. And we'll do it again next week. Hope you have a good one.
I got my I downloaded the Zoom while I was going in between. I went on to the internet and got a new version of Zoom updated, so now it works.
It's working okay?
Yeah, so I had to reboot the computer, download Zoom from the internet, an updated version remotely, because it was trying to prompt me to update it here, but it wasn't working. But when I did it, when I just went to Zoom on the internet and downloaded the most updated version, then it worked. So
okay, we'll remember that hopefully and follow through. Scott, it's been fun.
Yeah,
we'll see
I'll see you
Sunday.
Yep, see you Sunday at the beer garden. Is
Okay.
where our meeting's back there again. So
good deal.
6 o'clock. Yep.
All righty. You take care.
All right. Bye, everybody.
Bye-bye.